السلام عليكم. رمضان كريم عليكم، ينعاد عليكم بصحة وعافية إن شاء الله، وإن شاء الله كورس سهل وموفقين به جميعا إن شاء الله. نبدأ البيرا-operative course with the first lectures, types of wound. Object of our lectures, we must understand the acute wound from the chronic, and then understanding the healing process and the pathophysiology of the healing process, and how many type of healing process that occur for any wound of the body, and which the difference between the healing process of the skin and the other part of the tissue of the body. All these elements we must understand it. First things, we must understand the anatomy of the skin. The skin, the outer cover of the body. All the body are covered by the skin. So consider is part of immune. From the materials to enter the inside of the body, and these layers of the regarding anatomy of our skins, we consider in three layers: the epidermis, dermis, and hypodermis. The epidermis consider of the multi-layers of squamous epitheliums, starting from the deep stratum basalis to stratum spinosum, stratum granulosum, and stratum lucidum, stratum corneum. All these depend on the shape of the cell. According to that, we consider the name of it, from the basal layers to that of the granulosum or lucidum or corneum. It's only dead cells, squamous cells. This is the epidermis, while the dermis is full of connective tissue, contain rich in blood supply, contain elements of sebaceous gland, hair follicles, and also the muscles attached to the hair follicles, the nerve ending are still present in the dermis, and also it's fit on the hypodermis, the subcutaneous tissue. All these are simple anatomical things of the skin. We must understanding what the acute versus chronic wound. Whenever we have a trauma, any disruption of the surface epithelium, one consider this is acute wound, and usually this healing with a few days, about 2 to 3 weeks will heal continuously for the acute wound. While a chronic wound, look for that when there is healing process are not finished within this period, so it's slowly and remaining there is disruption of this epithelium, so consider as a chronic wound. So it's depend on the healing process and the time of healing process, and whenever we have a chronic wound means that development of the ulcerations, and this depend on the many factors responsible for that. Partial versus full thickness of the wound. Some element only damage to the epidermis like erosion, crushing. يعني احنا خلينا نكون واقعيين، دائما نتعرض هاي اللي نسميها السحاجات او اللي هي تتعرض من يحتك الجلد باي ماده خارجيه، فاحنا نعتبرها هذا only to the surface of the epidermis. So this is the erosion. Whenever extended downward to the dermis, we consider as the wound. What the healing process, how it's healed. This wound depend on different parameters. Like whenever I have a surgical wound or any wound by the sharp object, by knife, glass, and clean, tidy, we must understand the term of tidy wound, which means clean, not contaminated, clean, sharp edges. This wound healed by the primary healing, primary intention. So that's we called this healing by the primary intention, like our surgical wound, which is directly closed. While there is sometimes element of by the secondary intention, what we mean that we cannot approximate the skin, there is a skin loss, so that the healing by the granulation granulation tissue, and then the granulation tissue development of the healing process, and then contraction, then epithelialization from the edges to until the covering of this gap. While healing by the tertiary intention, that means that or delay primary, that that time there is no closure directly for the wound, and leave it for the time. After that we can after become clear, so this is we will do it for some reason or another's, leave it open the wound, like initially contaminated wound, or there is some problem in the closures, we cannot close the wound, and later on we can close it. So consider healing by tertiary intentions. So this is the type of the healing process, and this is also can be classified according to these. So when we look by the healing by primary intention, it's minimal scar, very nice, cosmetically better, while secondary intention there is a lot of scar and also ugly in proliferation, poor scar, ugly in cosmetic process and cosmetic appearance. Tertiary intentions, what we mean that delay primary intentions. As tertiary, there's lifting the edges open later on, like when I open like the surgery for the acute appendicitis, perforated acute appendicitis, so that the wound, our wound, surgical wound, is contaminated with the material of abscesses of the perforated appendix. So when I close the layer of the muscles and left the skin, sometime we left it open until 2-3 days, there is no sign of the infection, we can close it. So we can consider this process tertiary intention to return the tidy, returning the wound to tidy elements, and give good result, good cosmetic results. This is example. هذا مريض عندنا عنده diabetic foot ومسوي له amputation of the big toes with the second toe. نلاحظ ما نقدر نسده لأنه شنو؟ لأنه يصير عنده infection إذا سد رأسا. فش راح نخلي الwound open و daily dressing until a process of healing appear by the granulation tissue. ونفس الوقت راح يصير عندي the first things, the granulation tissue. Second element, contraction of the wound. The wound edges will be reduced in size. Third element, epithelialization from the edges of the wound until remaining only scar tissue of that previously wound. Phases of the wound healing. How it occur? What is the pathophysiology of the wound healing? When I have a wound, there is healing in 3 phases. The first phase is the hemostatic or inflammation phase of the inflammation, of hemostasis and inflammation. And the second phase is the phase of the proliferation. Third phase is the phase of maturation and remodeling. These phases are overlapped one and another. No sharp edge between each phase of the process of the healing. Hemostasis, the first things, whenever I have a wound, first things there's a bleeding. After the bleeding, the body try to stop this bleeding by hemostasis. So the hemostasis is the first primary healing process. Initially by the platelet aggregations at the site of the bleeding, to make thrombus and coagulations and for the prevent further bleeding. So we must look for the different cells at the time from the place of the coagulation and infection, and then development of the different cells according to look for the first cell response are the platelet, and after that the neutrophils, after that the macrophage. Last things for the proliferations and remodeling the fibroblast and the other element of the leukocyte. This is the example of parameters of the numbers of the cells on the day post-operative, so that it's appear on the day by day. Hemostasis and inflammation. The first phase, hemostasis and inflammation is the first phase, and this is the platelet activities and the whole platelet activities that release of the alpha granules from the platelets, including fibroblast and other tissue growth factors and transferring platelet growth factors, whatever the types of the growth factors, element of the cytokines, that all these from the granules or from the alpha granules of the platelets all released to give order, to give alarm for the other cells to start to work, to come to this place, because they are involved by the trauma or there is a wound in this place. So that after that, there's a fibrin clot surrounding and migration into the wound, and then infiltration by specific cell types like neutrophils, and this process usually becoming within 1 to 3 days. And this hemostasis macrophage entering into the action 48 to 96 hours, and its activities to remove the bacteria, remove the dead process, T lymphocyte, and all this can be summarized by the Latin words. Previously, we know that the rubber and the tumor, color, and dollar. All these sign of the inflammation. Means by the rubber is the redness, other side tumor means the swelling, color is the heatness, and dollar is the pain at the place of the this is the very old terms for the site of the inflammations. And this is the rule of the macrophage. It's a starting rule from the early phase to the late phase. So have a different from the wound debridement and phagocytosis, then until the end with matrix formation and remodeling. So that have very important rule, and they have different cytokines. There are different requirement materials to act in this place of the process of the healing. Second phase is the second that intermingled with the process of the hemostasis and inflammation, the phase of the proliferation, starting to regenerate and replace the lost tissue. What is this? Is the tissue continuity re-establishment. The action, what the soldier cells in this action leukocyte and macrophage. This is the cell that action in the proliferation is the fibroblast. Fibroblast synthesis of the collagen and carry out of the matrix contractions. This is responsible for the rebuilding of the tissue, and endothelial cells formation of the new capillaries, regeneration of the network of the blood vessels to supply this region, migration of the intact venules to close the wound, simulations of the VEGF from the macrophage, all these elements of the proliferation. Matrix synthesis and the starting production of the collagen is dependent on the oxygen supply and the nutrient and local wound environment. Proteoglycan synthesis, what the ground substance, and this is synthesis by the fibroblasts, which is the primary activities, and to produce the fibrils and fibrin of the collagens. Maturation, the last phase is the maturation and remodeling. After that, there's starting first protect, hemostasis, inflammation, then starting the proliferation to rebuild. After that, what I must rematurate this my building, remodeling my building, reorganization of the previously synthesized collagen and change from the type 3 to the type 1, which is more than, and this process can be considered reaching to the 12-week or 3-month until full maturation and remodeling, and even sometimes consider reaching to 6 months to complete remodeling of this process. Matrix component, there is changes, and collagen amount change from the tensile strength increase for months. Epithelializations, maturation and remodeling. Epithelialization restored external barrier. This is really begin within 1 day, covering the epithelium, especially in primary intentions, and thickening of the epidermis at the wound edges. There is thickening complete less than 48 hours in case approximation of the wound. The wound contractures, we consider that by the secondary intention. First things, whenever we healing by secondary intention, we tell that first things there is development of the granulation tissue. The remodeling what there by wound contracture. Decrease the surface area of the wound, and this is what by the myofibroblast postulated as a major cells responsible. This is myofibroblast responsible for the wound contracture and contain alpha smooth muscle actins begin at the day of 6. So look like whenever you have about 4 cm above, after the 6th day, it is reduced in size because of the process of the contraction. So reduce in the size. This is the phase on the pathophysiology of the wound healing. Then, all wound occur in the same process on the same day. Yes, the hemostasis and inflammatory 1 to 2, 3 days, and then phase of the proliferation is about 2 weeks, and that process of modulations and modifications occur in 3 to 12 weeks. All these are in these weeks? No. Depend on the many parameters that affected the wound healing. So we must understand these parameters. Why? To facilitate any patient export for the wound, to facilitate the healing process. So we must these factors, and we must understand our patient whenever patient presented to us with extremities of the age. What we expected this healing is early, is late, so that there is a systematic factors for affected the healing, like the age of the patient. Young age group, very rapid healing, like in neonate, infant, childhood, very rapid healing process. Whenever we're looking for the one case with about 80 years old, 75 years old, we expected very delay in the wound healing. Nutritional factors, that patient with good nutritional factors, good body build, there is no anemia, no hypoproteinemia, also favorable condition. So there is any problem in the nutritional factor, I must correct it preoperatively. Traumatized patient is not trauma that caused this wound. They maybe have fracture in the ribs, may have a trauma to the inside the organs, may have a blood loss. So we consider all these elements are risk factor for the wound healing. Metabolic activities, metabolic diseases, immune suppressions, patient with immune suppressant like due to acquired or congenital, due to other disease, or due to drugs like the patient would use steroid or immune suppressant drug, immune modulator drugs, whatever. Connective tissue disorder, there's some cases of not a problem in all. There is a connective tissue disorder like acquired or congenital, and then the smoking, which consider is one of the cause of acquired connective tissue disorder, primarily affected the action of the fibroblast. So we time understanding the smoking, where is the effect on the fibroblast that responsible for the proliferation, responsible for the collagen synthesis. So it's affected, so cause acquired connective tissue disorder, acquired collagen deficiencies. Local factors. What there is the mechanism of injury. We must understand mechanism is the sharp object by blunt object, and if there is development of the infection at the place of the of the wound, if there is no infection, and after that, there is edema or no edema, because the edema impair the blood supply and cause ischemia and necrosis to the tissue. A tropical agent, there is any abnormal tropical agent that can be a favorable healing process or unfavorable for the healing process. Previous radiation or ionizing radiation exposure the wound, oxygen tensions, is the area is good oxygen supply or not, presence of the foreign body or not. All these are considered as local factor. Whatever there is healing occur. Sometimes what happened, there happened excessive amount of the healing. This is also problems. What we have do surgery, and we clean surgery, tidy wound, no problem in our wound, we approximate it very well. What happened? There is excessive scar formation. There is no remodeling, there is excessive proliferation. So we have two diseases, two entities of a problem of the healing, which is there is excessive healing. It's the hypertrophic scar and the keloid. Within the confine, the origin, what the difference between that? The hypertrophic scar still within the wound, regress over the time, about develop after 4 weeks, and there is also cause some tension, and flexor area are responsible for this process of the hypertrophic scar. So it is some little bit mild problem in the hypertrophic scar, while the keloid is the problematic. Keloid, there is extended beyond the origin of the wound. It's a continuous process, like a tumor. It's not a tumor, but like a tumor in activities. It's continuous, increasing in size. No regression, rarely regresses spontaneously. autosomal dominant predominant. لهذا احنا نشوف المريض اللي يصير عنده كيلويد لازم نقول له الفاميلي مالته انه avoid for the any scar in special places اللي لازم نعرفها. Where is the place of the keloid? Keloid near the ear, in upper chest, over the sternum, the shoulder. All these places can be susceptible for the keloid. Can result of the traumatic and develop within 3 months to year after initial development, delay in development and continuous in activities, and these require the special multiple approach for the treatment, like surgical excision, steroid injection, even radiation, continuous pressure effect. Look for this element of the scar of the collar incisions, and this is simply only minimally elevated on the scar also at the site of the drain. So this is commonly subside within the time because this is a minimal scar or consider as hypertrophic scar, while other patients what they do punctures for the ear. نلاحظ هنا هذا اللي دائما هسه هاي الفيميل تجينا شنو مشكلتها؟ عندها مسويه ثقب للاذن، ونلاحظ ورا الثقب ايش صار عندنا هذا الهايبرتروفيك سكار و excessive increasing in size, eating all the surrounding tissue, very difficult to deal. This is the last slide I think, and the other lectures for the basic principle of plastic surgery. Thank you a lot.